Thank
All
you,
right, take care.
Christine. Esther, okay. Let's keep it in the Zoom room. We have Sergeant Paul Tapau standing by, but I want to get Lillian Posadas of the Guam Memorial Hospital. Lillian, I'm sorry about that, but thank you so much for coming on. Good morning.
Okay, understand.
Viva
Not a
Santa Maria
problem.
Carmelin.
Viva!
Yes, that's right.
Were you
It
able to
was a
see?
beautiful day yesterday.
Yeah, we saw, we were able to share the stream when she went by Guam Memorial Hospital, and what a touching scene. Were you able to go out and greet Our Lady when she went by?
No, I was down at Adelup. We had the cabinet members were there.
Right.
So it was beautiful. It was really nice.
Yeah, I think Guam really
Very
needed that.
heartwarming.
Yeah, definitely.
Yeah.
So, of
was
course,
impressive.
bringing you on for our COVID census update, and you know the deal. If you just want to get right into it, Lillian.
Sure. The which one? I didn't hear that one.
The COVID census.
Okay.
Yeah.
We are at 32 this morning. We were ranging 27, 28 over the weekend and also yesterday, but this morning it seems like to be creeping up. I hope it's not going to go beyond 32, but we are at 32. And of the 32, we have 8 individuals needing ICU level of service. And of the 8, 6 of them are on ventilator support. The SIF, the Barragata Heights SIF, we're standing it down. The 3 individuals that were there are now back to GMH. And so it is empty. And so we're working with the contractor to try and get started with the splitting up the HVAC system there.
I wanted to ask because we had had a tip here about another COVID-related fatality. Lillian, are you able to confirm that?
Today here at GMH, I haven't
not
heard.
sure.
We had one yesterday, but it was a non-COVID individual who passed away yesterday, but not COVID related fatality. I haven't heard that. I haven't received the information from our nursing supervisor, but I'll follow it up today.
Thank you.
But as of this morning, 7 o'clock, there was no COVID related fatality here at GMH.
Okay. Well, we can only ask, right, Lillian, if we hear stuff. So.
Oh, absolutely. And I tell you what I know, what I have.
Right on.
I haven't gotten the information, but I'll follow it up right away.
Okay. Thanks, Lillian.
Uh-huh. And as far as staff, we are still at 93 staff, total staff who tested positive. 1 was still in isolation as of Monday. No news COVID positive test of staff, and nobody is in quarantine right now. So that's where we stand.
Lillian, with the steady decline in the hospitalizations, have you been able to have some of the staff who maybe worked during the whole pandemic, are they able to get leave or take time off to kind of regroup?
We're trying to do that, but on the non-COVID side of the house, the numbers are up. Yes, people are coming in with non-COVID tests. They are coming in pretty sick.
What are we seeing?
We have the ICU non-COVID side. We have 7 individuals in the ICU who are non-COVID, and so we had several people in the emergency room needing to be admitted to telemetry and also to just regular medical surgical inpatient unit. And so on the non-COVID side, we're seeing an increase of individuals needing to be in the hospital.
What are they coming in for?
Many different conditions, heart conditions, telemetry, they need to be on telemetry. Their diabetic conditions, and hemodialysis, kidney, end-stage kidney disease. Those are the variety of conditions that are coming in.
How much of it is it because, during this whole pandemic, there are people that have stayed away from the clinic, that have stayed away from the hospital because they're just too scared that they might catch COVID?
Absolutely, yeah. And that was one of our concerns, is that, those with chronic health conditions, they're not able to go get follow-up treatment with their doctors or even get their medications, refilled. And so that was our concern, and that that's why we need to be prepared to then accommodate individuals who end up needing to be in the hospital. Hopefully that their hospitalization don't need to be long and that they can go home. They can be discharged.
But would you say that the reason why you're seeing this increase is because of that feeling that people didn't want to go and get their checkups and follow up?
I don't have the numbers, but that certainly is it's a very strong hunch and strong speculation that those individuals with chronic health conditions have not been able to get follow-up, care with their doctors. And that, they're probably scared. Absolutely.
Mm, yeah.
What about the staff that we've acquired from off island? Are we throttling back the number of people that we have here, or are we keeping them on hand just in case?
The staffing, the additional staff that we have from the staffing agencies,
Yeah.
we didn't receive it recently. We've lost quite a bit, and we will be getting some next week, but not a whole lot again, because remember, we're competing also with the mainland. Lots of hospitalizations and lots of demands for nurses and for doctors throughout the various states, particularly California. Their numbers have really spiked up, and
Right.
their numbers of people needing to be hospitalized have really spiked up. So they're also, challenged to get more nurses and more doctors into their hospitals.
Wow. So that's an unanticipated consequence that we're seeing here, right? Because of that surge stateside.
Yeah. So it's very possible why we're losing some of the nurses who are here.
Have you had any? We're losing nurses here, and you're saying non-COVID census is up. Are you having any issues juggling staff between COVID, non-COVID? Are we good on the staffing?
Knock on wood. No, not really. We have the staff, and so we are, and the staff have been very, very, accommodating and adapting to where they're needed. We assign them to.
All right. Any updates on BAMLAM and
Bemlam, Niviumab?
Total of 10 so far. 10 individuals received the monoclonal antibody therapeutics. That's the last count I received was 10 individuals.
Yeah, no complications, right?
No complications so far. Yes, and we're really looking forward to getting the vaccines to get that started.
Anything in closing you want to add, Lillian?
No, but just again to continue wearing the mask, continue social distancing, and we continue this fight against this COVID virus. So we just have to continue.
All right. Thanks, Lillian.
Thank you, Lillian.
Take care.
Jay, what do we have?
What do we have?
Lillian,
Vanilla's doggo?
she's
We have
hungry.
Vanilla's doggo?
Man, everybody wants Vanilla
Yeah.
Doggo, but